Hi everyone, my name is Jasmina Alajic and I'm an accounts manager here at Erchonia EMEA. Thank you for joining us on this enlightening webinar, Scientific Breakthrough of GVL, the most energetic laser in the world. In this new inclusive webinar, Dr. Silverman will share insights on the latest laser by Erchonia, the world's first and only FDA-cleared green and violet laser, GVL. For those of you who don't know Dr. Silverman is a chiropractic doctor, clinical nutritionist, national international speaker, author of Amazon's #1 bestsellers, Immune Reboot and Inside Out Health, founder and CEO of Westchester Integrative Health. The ACA Sports Council named him Sports Chiropractor of the Year in 2015. Dr. Silverman is on the advisory board for the Functional Medicine University and is a science officer with Nutrigen, chief clinical consultant for KBMO Diagnostics and Erchonia EMEA. We will be happy to assist you further at the end of the webinar, which for your reference will be recorded and sent out to all the attendees. I would like to alert you to the question and answer box on the right-hand side of your screen, which you can use to type your questions to Dr. Silverman. We will be addressing these questions at the end of this webinar, but please type them in as we go along. Okay, without further ado, I will pass it on to you, Dr. Silverman. Are you ready to take on this webinar?
I am ready, Jasmina. I am happy to be here. Thanks for that wonderful, sterling introduction. And I guess I'm clear. Good. Well, I have to tell you that I've been using the GVL across the pond for almost 2 years. And actually, I was co-lead clinical investigator with Dr. Kirk here. And we had to keep it under our hats, if you will, for 3 years prior to that. Just what we found out doing this FDA-cleared test. Just for your reference, FDA is the highest standard you can get, and this has an FDA clearance. So I'm excited to share some of the scientific breakthroughs. We talk about the concept of energy versus power, because the key to the clinical outcomes is allowing thermoelectric, or I should say electromagnetic transfer of energy. So let's dig in. My goal is to go through the slide deck in about 30 minutes, 35 minutes. Actually put the laser on myself, I'm right here, and then open it up for some questions, and feel free to put the questions in. Jasmina will sort them, she'll ask them to me, and we'll get to everything. I won't leave till all questions are answered. Confucius once said, to do good work, one must first have good tools. I do believe the laser is an outstanding tool. As a matter of fact, I believe it is the modality device of the 21st century. Real quick on that, the reason I got the laser was, as you all know, if you've seen me before, I suffer from congenital torticollis, and my neck is fused now, not through surgery, through natural means. So getting adjusted and getting work done on my neck was challenging, and there were limitations. So I really needed something to help me so I could practice, through my 80s and 90s. And a laser, Erchonia, of course, was suggested to me, and I used it on myself. I then used it on my friends and family, and then I became a full laser healthcare center. And then, of course, I speak nationally, internationally on it, which I'm very happy to be able to share some of the insights that I see going on in my practice setting. So one of the key elements was what it did for me personally, which allowed me to really grow professionally. As chiropractors and such, we begin to break down because it's very manual. And the laser, if anything, you should be buying for yourself first. So the takeaway in the GVL, the reason I call it GVL is green violet laser, is the first and only green and violet laser made. It had an FDA clearance in September of 2022, and the clear FDA clearance is chronic neck and shoulder pain. It is without question, to date, the most energetic laser in the world. So when we talk about the most energetic laser in the world, let's look about wavelengths. People, unfortunately, when they look at laser, they talk about power. And it's very disconcerting to me to talk about power, because power is essentially the power that you give. So you're trying to get more photons to hit an area. Even with a non-thermal laser like this, you're having approximately 8 billion photons per second. So it's really more of the ability in a collimation and to absorb the photons to allow for electron voltage. So when you take a look at the different wavelengths that Erchonia uses, the red is really less than 650. It's 632 to 635. You have 1.9 electron volts. Now that we've added the green, you get about 2.4 electron volts. And now that you look at the violet, which has been out for a while, you get 3.1 electron volts. If you compare and contrast that to something over 700 wavelengths, because it's all about wavelength, or as you get more towards the infrared, you only get 1.5 electron volts. So what does that really mean? Well, the key concept is a minimum of photonic energy of 1.7 electron volts, less than 700, is required to cause electrons to jump to higher orbits. You can't make it up by with a lower electron volt by increasing the wattage to trigger the same results. So you need the right wavelengths. Unfortunately, so many companies out there use a high wavelength. I'm actually having trouble with my periodontal, my gums. And there are lasers here that periodontists are using for the gums, and they're talking about getting good results. Essentially, they're burning the gums because they're using a wavelength of 1074. I told them I didn't want to use that laser. I wanted to use some nutrition in my laser. Would it be possible that I come back in 3 months and we could, remeasure? And I did actually ask this question. Sorry, I said, have you ever seen anybody's gums stop in their decay? And he said, very rarely. Have you seen anybody's gums become better, grow back? He said, no, I'm not going to say theoretically it could happen. I've never seen it happen. Well, I'm not in a good standing, but mine decay did stop. And I have a genetic marker for making plaque. And I have a genetic marker for having dysbiosis in my gums, which I never knew. There's some new tests. We can talk about that at a later date. I used the Erchonia laser for something that was off-label, the GVL, the green and the violet, and got real good results. Getting back to this slide, it's all about having the electron volts. The lower the wavelength, the more electromagnetic transfer of energy. It's about wavelength, it's not about power. So very interesting. How do you affect the mitochondria? Well, most people don't remember, but there's actually free floating mitochondria in the bloodstream, which will absorb photonic energy and disperse it throughout the body. This allows photonic energy to affect sites away from the application site. It shows that the laser that you're applying to your patients when you use the GVL or any of your Erchonia lasers are systemic and they have a global effect. It's not a slide, but I have this in other slide decks where people have done an application to the right side of somebody's brain, and the left femur has been positively affected, the left femur area, crossing over and down in a totally different quadrant, which really speaks to the idea of mitochondrial function. Now, talking about mitochondria, photonic energy is absorbed by the mitochondria, the powerhouse of the cell. As a matter of fact, mitochondria is responsible for about 90% of our ATP the body needs to function and really provides a pivotal role in cell life and cell death. Mitochondrial dysfunction is very commonly seen in long COVID. As everybody knows, I wrote a book called Immune Reboot, fatigue, aging, autoimmunity, and now it's come to the forefront in neurodegeneration. Mitochondrial dysfunction may be the leading cause now of neurodegeneration and neurodegenerative diseases. So a takeaway is the laser will fuel the mitochondria, which means it'll make efficient ATP and decrease the amount of reactive oxygen species, ROS, that the cells make to make ATP. And that's one of the reasons that utilizing the laser is anti-aging as well. So let me say that one more time. The laser allows you for efficient ATP production. The exhaust to making ATP in the mitochondria is reactive oxygen species. If you utilize a laser, you're making efficient ATP, minimizing reactive oxygen species, whereas in most instances, people are having mitochondrial dysfunction. having difficult making ATP efficiently, having more reactive oxygen species, leading them down a path of early aging. So what produces the ATP in the mitochondria? Well, it's the inner layer of the mitochondria is the site of the electron transport chain. So this particular slide really does it all. Here's a photon hitting an electron and allowing it to jump to a higher valence. So electron transport chains use high energy electrons to convert ADP to ATP. When the photons of visible light energy strike certain atoms, that energy may push an electron from that atom to a higher energy level where it can be picked up by an electron acceptor in the electron transport chain. So let me give you a vivifying example. On a football field, an American football field, I'm sorry for using this as my metaphor, it's 100 yards. You could place 22,764 mousetraps. Inside the mousetrap would be a ping pong ball. That ping pong ball would be an electron. Jasmine and I are on the sidelines, and because she's saying I've never seen an American football game, and I'm standing there with one ping pong, and my ping pong is a different color, and it's a photon. And Jasmina says, let me throw all these ping pong balls in the center of the field. I said, no, you don't have to. Watch the power of one photon getting in and just throwing it in the air and watching systematically all the mousetraps fire off. That's exactly what a collimated Erchonia laser does. All you need is one, the power of one, to start the electromagnetic transfer of energy cascade. So treating the electron transport chain with Erchonia laser, I think this may be the biggest takeaway. If anybody has a cell phone and they want to take a picture, this is the time to do it. So we found out that you need to have all four complexes in the mitochondria to make efficient mitochondrial function. So jumping right ahead, complex 1 and 2 are stimulated by a 405 nanometer laser. Complex 3, which was never utilized previous to this, gets stimulated by the green light, the 520 nanometer light. And lastly, the red light, complex 4, gets stimulated by the 635. So the cascade of these three wavelengths lead to proper ATP and mitochondrial function, avoiding mitochondrial dysfunction. I will show you in a few minutes how to stack some lasers after showing you what the GVL looks like. So here's some key themes. Complex 1 is considered a rate limiting step. Truthfully, they're all rate limiting steps. To get full mitochondrial function, you want to use complex 1, complex 2, complex 3, and ultimately complex 4. Remember, violet light, 405 wavelength, complex 1 and 2 it stimulates. Green light, wavelengths 520 to 532, complex 3. And last, to complete the whole complex activation, complex 4 is stimulated by 635 red light. Now, everybody knows that I do a lot of functional medicine and I deal with a lot of pathogens, if you will. So that said, we've always talked about the violet light being the most immune enhancing, which is true, and killing most of the pathogens. But when you look at this slide, you realize that the violet light emphasizes the killing of bacteria and virus strongly, whereas the green light also does bacteria with some fungi, and the red light actually kills parasites. So again, that cascade of the three lights really is going to allow you to elevate your clinical outcome. So let's talk about the FDA clinical trial, neck and shoulder pain, that I was a lead clinical investigator on. So take a look. Here you have the number of subjects, and you've got the red light, which had an FDA clearance, which is called the accelerate. You have 44 subjects. You have the red and the violet light, which is the EVRL. The EVRL was another laser study that I did the FDA clearance on. And then the green and the violet, the GVL, was 43 patients. So let's take a look at the pain duration of the subjects. In the accelerate, the red only was about 62 months. The red and violet, it was shy of 77 months. And of course, the green and violet, it was 89 months. Then take a look at the subjects meeting the study success criteria greater than 30% in pain reduction. The red light was 65%. The red and the violet was 75%. And the green and the violet was 81%. So when you look at it, every time you added an alternative light with the red light, it got better. But when you put the green and the violet, you had the best outcome. So red is fabulous, accelerate. If you have one, don't throw it out. If you have an EVRL, definitely continue to use it. The choice of the three, if you haven't purchased one to date, would be the GVL. Improvement in pain from baseline to immediately after treatment, 48% in the accelerate, 45% in the EVRL, 52% in the green and the violet light. Improvement in pain from the study endpoint to 48 hours post-treatment, 43% the accelerate, 50% the EVRL. Look at the green and the violet laser, 65%. What a dramatic change. And lastly, in the range of motion, the accelerate was 14%. The red and violet, the EVRL was 29, and the green and violet 32. So the synopsis, the truth summation takeaway is the EVRL is wonderful, the accelerate is wonderful, but the GVL beat either one of them, or both of them, I should say, at every juncture of the study. Now, 98% of the subjects recorded were satisfied with the treatment outcomes. We're going to come back to that. 100% of the subjects recorded pain production at 24 hours post reduction of pain, post treatment. Now the 98%, I'm going to tell you now, I'm going to disclose, the one person that took it down from 100 to 98% was my patient. It's a 26-year-old male who, after getting treated, filled out the forms and was excited, went and played tackle football, and he played quarterback, the position that you get hit more of, and they played football without wearing equipment. So it's almost comical what he did to say that he was not satisfied with the treatment outcome, because he felt that the laser was supposed to protect him from the next day soreness of getting tackled by 300-pound men. So really, let's delve into the vicious cycle of mitochondrial dysfunction. So neurodegenerative diseases, once again, violet light impacts complex 1, which impacts the tau and the alpha-synuclein. So tau tangles, as we know, has something to do, or is a major play with Alzheimer's. Alpha-synuclein also has something to do with Parkinson's disease. Violet light in complex 2 has an effect, a positive effect, by impacting Huntington's. The green light, complex 3, impacts SOD1, and the red light, complex 4, impacts beta amyloid plaques, Alzheimer's. So clearly, if you have an EVRL, you're in good standing with Alzheimer's, but if you want to branch out and do more, you need to add the GVL. Interesting, let's make a note. Alpha-synuclein and all these amyloids, they come from the gut to the brain. So I'm going to make sure, at least remind me, Jasmine, if I forget, to show you how to laser the gut with the GVL and the stack of our handheld lasers. So, children's autism. 90% of children who have autism have a gut dysfunction, and most of which is banked on dysbiosis. And typically, the mom also has this dysfunction because the child obviously gets the bulk of their microbiome and their immune system from their mom. So 60% of the children had issues with complexes 1, 2, and 4, and 40% had issues with complexes 3 and 4. So for autism, you need all 3 wavelengths. Osteoarthritis. As a chiropractor, this is probably one of the most, if not the most common conditions that you see. And here you're looking at complex 1, complex 2, and complex 3, decreasing the activity compared to normal chondrocytes. So you're really exemplifying how you need the GVL in a musculoskeletal light for musculoskeletal conditions, and including autoimmune conditions, because without question, osteoarthritis for me is an autoimmune issue. So a common example that can inhibit the electron transport chain and impair mitochondrial function. Common pain relievers, NSAIDs, non-steroid anti-inflammatories, aspirin, ibuprofen, etc. Now, NSAIDs, as we know, do decrease pain, but they impair healing. Laser decreases pain, but promotes healing. Which do you prefer? How common is it that our patients use an NSAID and leave an Advil, an ibuprofen, a Tylenol? I understand, well, Tylenol is a pain and fever. They're probably different names where you are, but I think everybody knows what I'm talking about when we say aspirin. So they're so commonly used, yet they are essentially very detrimental to our mitochondrial function. The idea of lowering ATP levels lead to hypersensitivity and chronic widespread pain. Most people are coming in with pain to our offices, as we know, and lower ATP is a common thing because, again, it's really bringing to the forefront the idea of mitochondrial function, i.e. really mitochondrial dysfunction. So this was a study at the University of Illinois at Chicago, and it studied a Erchonia laser set, or what we call the base station. We call it the trident. It's an accelerate, it's an EVRL, and it's a GVL. So they surmised that the 635 nanometer improved mitochondrial activity. It had a prolific activity effect. It increased the productions of interleukin 10. Now, this is very important. Interleukin 10 is one of the only anti-inflammatory interleukins. In that, because when it's elevated, it promotes anti-inflammation, but it also conversely shuts down pro-inflammatory interleukins like interleukin 1 beta, interleukin 6, interleukin 8, and TNF alpha. The 405 nanometer violet light allowed for the reduction of apoptotic cells on fibrous tissues. Nothing does a better job with scar tissue because it also showed improved breakdown of scar tissue due to high electron volt possibilities. Remember, it was over 3. And 532 nanometers led to the reduction of TGF beta, which is an inflammatory pathway. And check this out, biggest stimulation of stem cells. Now, one of the reasons that I exclusively use the GVL on the gut is because of the GVL's ability to obviously have the green light and the stimulation of stem cells. Stem cells can grow back optimally in 4 to 5 days. They are needed for our epithelial cells in our gut, which has the highest turnover rate in the body of 5 to 7 days. So that stem cell stimulation going to work great on leaky gut. So let's break down what the green light or the green wavelength can do for you. 532 has a positive effect on osteogenic differentiation. So basically, it facilitates bone repair, also facilitates nerve regeneration. So when people ask me bone fracture, shin splints, green light, nerve regeneration, used to be red light, green light, action potentials for nerves, green light. It also has shown the 532 nanometer an increase in mitochondrial transmembrane potential of about 13%. So really positively affects mitochondrial production. Osteoplastic differentiation, again, stimulated. There's osteoplasts and there's osteoclasts. Osteoplasts are giving off because they blast their way to making new bone. Osteoclasts decrease bone development. One of the bigger problems with osteopenia is that there's an unleveling between osteoblast and osteoclastic differentiation. The green light helps with osteoblastic. So for a lot of our osteopenic women patients at 40 to 50, 50 to 60, this is a great choice to utilize for that. Again, I mentioned before about the idea of a nerve and action potential. Nothing stimulates the action potential more than the green light. All the data was on the red light and it's still robust. However, when matching green to red, the green light was much more effective than the red. And lastly, the continuation of the previous slide where they used different wavelengths really showed that the green light was more effective than the red light. Fibromyalgia, I love to talk about fibromyalgia. Which sex typically gets fibromyalgia? The answer is 70–75% of fibromyalgia patients are women. It is an autoimmune condition. It's been beaten and thrown around. However, we now know that fibromyalgia is an autoimmune condition. In this study, the conclusion was fibromyalgia patients exposed to green light had a significant improvement in their pain, sleep, and quality of life. When you look at the green light, also, green light when applied on normal human blood for different purposes was shown to have potential influence on blood components. Low-level laser may have potential effect on the blood of people with different kinds of cancer. Nobody is purporting to use laser for cancer. All we're saying is that in an immune setting, the green light is stellar. Green light and immunity, piggybacking on what I said before, the results indicated exposure to low intense green light accelerates the antioxidant system and immune system. Green light conditions effectively reduce oxidative stress and promote immune function. So if anybody has any questions on the green light, put them in. I'm definitely going to answer them. I am coming. I should be ending in about 8 minutes, 9 minutes, and then I'm going to turn on my camera, show you some very easy moves with the laser, show you what a stack is, and answer your questions. So a lot of people ask, why the violet light? The violet light enhances physiological outcomes because it has more energy per photon, not as in milliwatts. So interestingly enough, the violet light has the most electromagnetic transfer of energy. Therefore, it works in a shorter period of time. It's more antiviral, antibacterial, antifungal, and has a greater response to immune function. So the antimicrobial properties of the 405 nanometer light. Violet light is a visible light shown to elicit strong antimicrobial effects towards many pathogens. Huge takeaway. This is where the study from 2014, 10 years ago, where I got the idea to start lasering my gums. So irradiation of a 405 laser has significant bacterial fungicidal effects. P. gingivitis. Gingivitis obviously is the bacterial infection in the gums. It makes an enzyme called gingipans. 90% of Alzheimer's patients have the enzyme present, gingipans. So one of the things that I would do in my anti-Alzheimer's protocol is, believe it or not, laser the gums and have nutrition for gum health. So 5 minutes exposure to 405 nanometer had a 60% inhibition in P. gingivitis and 80% inhibition in P. intima, and Candida albicans 90% from 10 minutes exposure. Now, Candida albicans is 97% of the time found if increased in size, leading to what we call small intestinal fungal overgrowth. So I've coined a term that's in the data now. It's called SIFO, small intestinal fungal overgrowth. 97% of the yeast that overgrows in your gut is fungus. Candida albicans has shown to increase the incidence of Alzheimer's as well. So the 405 nanometer has a strategy for prevention and treatment of endodontic infections. The versatility of the GVL and the Erchonia lasers is on display here. So here's another one, a 405. It's used in the US hospitals for bactericidal effects. So when they clean surfaces, they use a violet light. 405 also increases the level of nitric oxide and its effect on viruses. Stimulates complex 1 of the mitochondrial respiratory chain, can be used as a photodynamic therapy for antibacterial, antiviral, and parasitic organisms as well. Talked about the stem cells before. Let's take this bullet by bullet. As I said, the intestine is the most highly rejuvenative organ in the body today. Regenerating its lining, its epithelial cell lining every 5 to 7 days. Continual cell renewal allows epithelium to withstand constant wear and tear, while breaking down foods, absorbing nutrients, and eliminating waste. Intestinal stem cells are responsible for the ability of the intestinal epithelium to efficiently renew and repair itself throughout life. Intestinal stem cells reside in the base of the crypts of the intestine. So here's my protocol. Intermittent fasting, time-restricted eating. I'm a big proponent of fasting each day for 14 hours and eating within a 10-hour window. If anybody has any questions on that, feel free to ask. The data is very strong on that, on those hours. I utilize low-level laser therapy. I use the green and the violet light as a starting point. And here are some supplements that I would recommend also to regenerate intestinal stem cells: glucosamine, chondroitin, resveratrol, curcumin, quercetin, vitamin D, and fish oil. So as we say, it's demo time. So I'm going to turn on my camera. And in the interim, Jasmina, can you see me?
Hold on, Satan. Yes, I can see you now.
Hello, everybody. Look what I've done.
I have questions asked from one of the customers that he can see your slides, but he can't see you. He said, I can't see Dr. Rob, but there you go.
I'm right here. I was here the whole time, I swear to you. Could you hear the noise outside? Anybody?
I can't hear anything, so I
Great.
don't
Yeah,
think.
I almost was going to show everybody what it's like to see a New Yorker in a New York minute because they're blasting away on the cement when I told them not to. But that's okay. I'm happy nobody heard it, and I kept calm. Hi. Were there any other questions other than that?
I haven't got any questions. Yeah, so you can go ahead with the demo.
Okay, so I'm going to set this up.
So as we said, if somebody has any questions, feel free to drop them here so I can ask Dr. Silverman. We don't need to wait right at the end of the webinar. So we can be a bit more interactive.
Well, you should be able to see. Let me get on my dark. I'll put it on my skin so you can see both the green and the violet light, green and the violet light. So it works the same as all the other handhelds in that there's two different lights. So let's start real easy. Let's start with the gut. I'll give you my master gut. It's called, the frequency is 44926. Let me see if I can do this. This should be perfect. So laser the whole gut, sweeping in circular areas, counterclockwise, clockwise. And now you've got a gut protocol. Now, those of you who have seen me have said, wait a minute, that's the same protocol and the same frequency as the EVRL and the accelerate. That is correct. The frequency of the light doesn't change. The only thing that will change is the effectiveness and the time. So essentially, if you were to ever expose with the accelerate for 4 minutes, you could do 3 minutes with the EVRL. Now you can do 2 minutes with the GVL. So it's really going to increase in 50% intervals your outcome. And I think you had a question.
We've got one question from one of our customers, and he will like to see, Rod, if you can go through a protocol of thyroid, please.
Sure. Real simple. Laser the thyroid, 5 minutes, and laser the gut for 5 minutes. And that's my thyroid. Now also, I also nutritionally fix the gut, and I use a lot of anti-inflammatory nutritional supplements as well with the gut. So for me, you can laser the thyroid, but I do believe that 75% of my patients have a thyroid issue because they have a gut issue. Now, there is a study on thyroid and laser, and I think it was a decrease of 47% usage of the medicine with just a laser application to the thyroid, not the kind of application that we're talking about in addition with the gut. So you're going to get some great outcomes if you just laser the thyroid and laser the gut. Any other questions?
That, yeah.
That's a good question.
There was one question here. It says, can the laser be still? So I think the customer is thinking of like holding the laser into one place instead of moving it around. Yeah.
Yes, I'm moving around, but my right hand now is the stand, and you can just leave it there. You can walk out, sure. There, you guys have a stand available for the docs, correct? So, stand, brain. Any other questions? Well, let me show you how to do.
I'm sure they just want to probably want to know the frequencies for the thyroid. They would want to know the protocol for thyroid. What would be your protocol be for the thyroid if somebody?
What frequency? I can't remember the thyroid frequency offhand because I have to go in, and this is actually my demo, so I just put some numbers in just to put the light on. I wasn't trying to actually affect my thyroid. So I do want to say something. It's interesting, everybody looks for the frequency. It's the wavelength, it's the collimation, it's the low power, it's the pulsing. Those are the key elements. The frequency is the icing on the cake. And Jasmina has all my frequencies, and I think it's including thyroid. Certainly all the ones with the 3 phases of care, because I know we give you all of that when you purchase the laser, and I think they have another one for the GVL. So you should all be able to have access to that. So the frequency, again, is the variability. It is, I'll use it again, the icing on the cake. Everybody thinks the frequency is the treatment, and it's really not. You know, there's something that I said that everybody was talking about on social media. Analysis by paralysis and the search for perfectionism has actually been more detrimental than failure. So sometimes we wait too long and we worry. If you're not sure, you can't hurt anybody by turning on the laser and putting in a set of frequencies. So that's what's most important. Of course, it's better to use the type of frequencies that we suggest. And also with that, most of my frequencies are going to be 50 or less, because I believe most people are in acute status. And 35 and 30 or less is really acute. 30 to 50 subacute, and then over 100 is more of a chronic condition, if you will. So you won't see as many 100 frequencies in the frequencies that I utilize. So I think you have another question. I heard you.
So there is another question. What would be your protocols for severe bronchitis?
Okay, so severe bronchitis. So interestingly, you want to work with the bronchial and the bronchioles. So just remember, yeah, you should be able to see me. They go like this. They don't go straight up and down like the lungs. So the bronchioles kind of go like this. They're more midline, and then they come to the center part of the lung and they go outside. So this became more popular with COVID. So I start right here. We're going to do the right side. So it's, I'm going to stand up. I'm in my house, everybody. I'm going to stand up or try to. 1, 2, 3, 4. 1, 2, 3, 4. So it's those 4 parts. Thymus, everybody. You can probably hear me pounding. Thymus and bronchioles, excuse me, tonsils. And then, of course, posterior. So I'm not going to turn around, but posterior.
Yeah. Well, I've got one customer. I think this lady, she's got a Virgil laser, and which is the green light, and EVRL, and she's asking a question. So what about the Virgil in combination with the EVRL? So I just guess they would probably work together quite well.
Yep. Yep. So that would be like stacking. So
I mean, just like the emerald laser as well. Whoever have the emerald laser, they can combine those 2 lasers. We always say it's very good to combine all the lasers, all the lights at the same time.
Right. So you're going to, so this is an EVRL. So it can be an EVRL and accelerate, but I have the GVL. So again, the GVL is going to stimulate complex 1, 2, 3, and 4. So you need the red light to get complex 4. So this is going to be 1, 2, and 3. The red light's going to be complex 4. So here's a stack. I'm putting them both together, and I'm lasering my neck. So I have all 4 lights working together. So I get full mitochondria. So when I demo in front of people, I'm turning muscles and nerves on in 5 to 10 seconds using all of these. The increase time to outcome is drastic when you add all of these. So I'm always stacking. Now, interesting with the stacking, I'm not just stacking for mitochondria complexes 1, 2, 3, and 4. So the GVL right now is programmed for, or the frequency is appropriate for muscle. The accelerate EVRL that I'm holding in my hand is for nerve. So stacking, not just stacking the lasers for the complexes, but stacking for dual purposes. I could do ligament and tendon. I could do tendon and cartilage. I could do bone and muscle. So if everybody understands the dual purpose of the stacking, you'll really see why you want to use the two different lasers together. And especially if you're going to do gut and or brain. And the easiest way to do the brain is, everybody knows who Elvis Presley is. The reason I bring up Elvis is that I want to gyrate. I bring up Elvis because everybody remembers his famous army haircut. So there's 6 lobes, just here's pretty Elvis, if you will, and they're combing it back. So it's the comb back all the way through the cerebellum, forehead through the cerebellum, etc. And then the unfortunate older man comb over, comb over, and then you come back the other way and comb over. So you're going to get the area from the forehead up and through the hair, through the back. I'm happy I combed my hair today. Any questions on that? None, Jasmina?
Well, I guess we went through quite a lot of stuff here. People are asking about brain, gut, vagus, which that's what we already do even with the EVRL. But as you said, now with the GVL, you will get even better outcome because we've got the green light included here. So I guess frequency they can use just like the EVRL. But
same frequency. The frequency doesn't change, just the time to outcome changes. It gives you ability to get the mitochondria.
You get shorter time now added onto it.
Right, saved, time saved. So
yes.
I did the EVRL and I was the first one to talk about vagus nerve, and violet and red light. There's data on that, real powerful. So the tests are done by HRV, heart rate variability. And I test all my patients' heart rate variability in the office. It's just an outcome that I like. It's very objective. I can speak to medical doctors and they'll be very accepted. So this one is about 25% more effective with HRV. So when you come see me in June 29th and June 30th in the London area, I think I'm in the London area.
Yes.
Yes. Please bring any kind of Oura ring or any kind of watch or whatever tests your HRV, and I'll prove it to you in the seminar setting. You'll be quite impressed. You'll be real happy. So for the vagus nerve, the frequency is 10, 10, 10, 10. For the brain, the frequency is 1, 5, 10, 40.
So these are the standard frequency, which, they're already uploaded into the laser. So whoever gets the lasers, they already have these standard frequencies uploaded on the device. Yeah.
See, what you've done, which is a little different in America, is that you guys preloaded. So you just press the button. So when you ask the frequency, it should probably be in there. I'm sure there's a few things that come up in your office that'll be new, but I mean, I think you've got like 40 or 50 frequencies for me put in there. I can double check right now. Anyone else?
So anyone else wants any other frequencies from Dr. Silverman, please let us know, and then we will email them to you separately. I've got a question from another customer who is asking, is there any experience like from your side of the lasers on diabetes type 2?
So for me, diabetes type 2 is a few things. Obviously, I'm going to say the common thing: cut down on carbs, cut down on high glycemic carbs, cut down on the sugary carbs. I'm also going to laser the gut because the gut's going to absorb sugar. And I'm going to tell people also to decrease the amount of fructose that they consume, and certainly fructose at any one sitting, because their gut can only absorb up to 5 grams of fructose. So I'm going to laser the gut, I'm going to laser the liver, and then I'm going to laser the pancreas. Lastly, with all lifestyle changes in addition to that. So cut your carbs, laser the gut, laser the liver, laser the pancreas. all of which you have in your presettings.
There is another question saying, what difference have you seen in practice with the GVL? And if you could share some probably case studies, your own one.
I'll give you a few case studies. Neurodegenerative diseases like Parkinson's and Alzheimer's with patients that we're treating before. Now understand that for me, neurodegenerative diseases have an origin in the gut, and that's been proven out. So it ends in the brain, or it may initially start in the brain, but the gut is the basic centerpiece for neurodegenerative disease. So everybody remember that. So I'm not just lasering the brain with neurodegenerative disease, I'm lasering the gut. And now we know that we don't just stop the onset of neurodegenerative disease in many instances, not all instances, if, of course, and this is a big caveat, if, of course, the patient is following the program, you know, making the necessary lifestyle changes, coming for their laser treatment, etc. So those 3 or 4 patients that are coming to mind who I was working with using the EVRL prior and then switched to the GVL, there was a vast change because of the mitochondrial complex. And also because of the ability to stimulate the stem cells. That green light stimulates the stem cells. Also remember, the green light is close, if not equal, to the violet light for pathogens. And we know that it's pathogens, or in many instances, it's pathogens that cause multiple sclerosis, Parkinson's, Alzheimer's disease, and I know it's not neurodegenerative, autism. So those are some case studies that just come to mind that change neurodegenerative disease, just pure gut issues as well. And in a musculoskeletal light also, as compared to the Accelerate, which is a wonderful laser, has an FDA clearance, and EVRL, the next step up, a wonderful laser. The top shelf step is the GVL. So the real question is, I know people ask me this when I lecture, where does the GVL fit in? For me, if you don't own any handheld lasers, the GVL is the choice. If you own one of the other handheld lasers like an Accelerate or an EVRL, GVL is now the dynamic duo. It's the complement. If you want to have all handheld lasers in your office, you get the Trident base station. Now, I'm going to pull the laser over here. I didn't expect to do that. Just give me a half a second. Can you see? Can you see my FX, everybody?
Yeah.
So you can stack the FX easily. It's not plugged in, but you see it goes right, typically goes in there. That's the first time they ever did that, of course, live and recorded. Great job. That's because most of the time my wife puts it in. There you go. And now you're going to get, if you have an FX, you can now add a handheld GVL to it, and you can stack in this manner. What you're seeing right here with an FX and a GVL is something I do all day, every day. So that's the last kind of stuff that I would talk about.
Was that the 635?
Yeah, I have a 635 in my house.
Okay.
So you stack the 635 with the GVL to get
the green light altogether.
Right. And by the way, you saw how it fits right in. You can just put it in.
Yeah.
Any other questions?
Do you normally do brain protocols with quick exercises?
I do brain protocols with eye exercises, quick exercises, and neurobiotics where I'm using my hands and everything, because believe it or not, this hand I'm having a little trouble with because I've got so much scar tissue from trying to lift weights that I have to do different things. It doesn't respond just quite as well. And I picked it up where it's about 95 to 96%. I'm getting a fascial problem. And I laser my brain when I do this. So if you wanted to laser your brain, you could just laser your brain with the GVL, or even better with the FX635 and the GVL together. We doing all right with the hands-on, everybody?
So what protocol would be for OCD brain?
I would just laser the brain. I don't have a specific protocol for OCD. I know I live in New York, and I'm sure about 50% of the people that I see are OCD, and maybe I am also, but I would just laser the brain with your standard brain protocols.
And gut as well, yeah?
Yeah, always. It's always, if you're not sure what to do, it's gut, vagus nerve, brain, you can't go wrong. That superhighway to health is critical. Well, let's open it up for another minute of questions, and hopefully I was able to.
We've got some questions here. I mean, I don't know specifically what this customer is asking for, but he's mentioning something of frequencies for allergies. So, I mean, we know there is a different kind of allergies as well, but yeah,
Right.
any experience with the lasers and allergies?
Again, I do a lot of allergies. It's funny, is it allergies? Is it food sensitivities? It really
Sensitive.
begs, right. Are you allergic or sensitive to it? Again, we're going to do the gut, we're going to do the vagus nerve, etc. And we're going to isolate what are they allergic to. I mean, we can go down that rabbit hole, which we're going to try and avoid, of mold, microtoxins, allergies, sensitivities, microplastics, etc. So I think we should like put a pin in that for now.
Will the laser help with people who've got dementia? So I think we already spoke about that,
Yeah.
about neurodegenerative diseases. Yeah.
Dementia is a key symptom to Alzheimer's. I know there's a question on my Dr. Rob's laser discussion board. So the answer to it is yes. Just use the application that we mentioned. Let me move my minions. Let me tell them if they want to be a laser Jedi master and impact complex 1, 2, 3, and 4 of the electron transport chain and support the mitochondrial health, you need 3 true collimated laser wavelengths. So you need the violet for complex 1 and 2, green for complex 3, the red for complex 4. I'm going to tell everybody if they're interested in following me. Jasmine and I were just talking about it. I've almost doubled my social media in the last month. We're just like on fire. People are starting to have some interest in what we have to say. So feel free to follow me, see if I can inform you. You may want to share with people. There's your Facebook, you can take a picture,
Yeah.
your Instagram, and I have a podcast that it just was #3. I live in what they call Westchester County. There's 1.3 million people. I'm now rated as the 3rd biggest one in that little county, And so if anybody who's interested, you can follow it. We usually only do film for about 45 minutes. We try and keep it tight. There's some laser practitioners that have been on there as well. And if you're interested in having me get somebody on, I'm happy to share. That's my Dr. Rob's Mastermind Laser Group. Most of you are probably on it, but if you want to join and ask a question, partake in the discussion, I'm happy to do so.
Yeah.
There's my book, Immune Reboot. Everybody knows about that. We're going to bring some copies. I'll be out June 29th and June 30th. Jasmina will inform you. They're just going to advertise it this week. So I'll be coming out 2 days hands-on. We'll be talking about longevity on Saturday, and Sunday is going to be a different topic. We're really going to delve into much more depth and many more case studies, all hands-on oriented for the GVL on that Sunday.
Well, thank you very much, Dr. Silverman, for hosting this webinar. I hope everybody is happy. And yeah, the recordings of this webinar will be sent out to all the registrants. And if you have any further questions, please do let us know. We will be able to help and send you anything, any information you're requesting from us. Well, thank you very much to everyone who have tuned in tonight, and looking forward to see you at his seminar in London. And well, have a great evening, everyone. Bye-bye.